All right. So, on Friday, I just figured I'd update people who are interested, who are curious. Well, not really curious at all, but who, my friends, family back home, or in general. As of Friday, I tested positive for COVID-19. What does that mean? Well, obviously quarantine, self-isolation, etc. You might be thinking, why are you out walking right now? Well, there's no one here. And per CDC guidelines, you can actually go for walks as long as you're a distance, right? Literally no one's here. I was the only car in the car park. If people do show up, I will stay very much clear. I have double masks. I'm good to go. So my video cut short while I was out, unfortunately. But anyway, like I said, I'm feeling fine. Luckily, no signs, no symptoms. Feeling good. Grateful that for my health at this point, obviously. Grateful that it's me in a selfish way and not someone else who is more high risk. Very grateful for that, actually. So I think coming from a health standpoint, obviously I'm very lucky with that, that I do take care of my health. Obviously, I know that's not the case in certain situations. I know there's obviously people who are very healthy who are having way worse symptoms. But it's just bizarre because like all the telltales are not there. You know, I don't have a fever. I don't have loss of smell, loss of taste. Everything is still fine. Obviously, I only tested positive on Friday, but I'm feeling good. Thank you for asking. Basically, I just wanted to let everyone know that I tested positive. Just to be on the lookout, I guess, because the only potential symptom that I had was a headache on Thursday, but that could be attributed to a lot of factors. And if you are unsure whether you've been, like I knew I had to get tested because I was exposed on Monday, or potentially exposed on Monday, to someone who then tested positive later on. So, immediately self-isolated to an extent. Didn't necessarily stop daily life in terms of going to the shops or anything, just because obviously I didn't know. But obviously when you go into the shops, you are wearing a mask, you are staying 6 feet apart, and obviously washing your hands whenever possible, just staying healthy as possible. So I think what I'm trying to say is that it can obviously affect anyone. Don't think that just because you're young, like I'm only 29, obviously if you're in your 20s, early 20s, or even your late teens or whatever, don't think that you can't get it, because you probably can. Just because you're not showing any signs or any symptoms, you might still develop it, and you still might catch it, and you could still potentially pass it on to someone who's not as fortunate as you to have a strong immune system, and that could be bad news. So I just want to get on to my final point, that from a fitness and health standpoint and from a coaching standpoint, that if you do not currently have a health goal of 2021, like if health is not a primary goal and your goal is next year to maybe just live life to its fullest, understandable, because you couldn't do things this year, that's fine. But also note that if you don't have good health, you can't do those things, right? If you're ill and you're hospitalized or whatever, you can't do those things. So make sure health is a priority. And I'm going to give a little plug here to some supplementation that I think everybody should be taking no matter what, to stay in tip-top shape, especially during the winter. It's important, the basics, right? If you can't get any of these other things, just get a multivit. Obviously, your nutrition should be on point. You should still be trying to be as healthy as possible. You should still trying to exercise. you should still exercise. You should still go for walks. Aim for a few thousand steps a day. Keep that heart health in check. Vitamin C, obviously we know the benefits of that. And a big one, apparently, according to the research, like if you listen to Joe Rogan, he talks about this all the time, but vitamin D. I take 4,000 IUs minimum a day, sometimes 6. As of right now, I'm taking 6 just to be 100% certain. Because obviously the benefits are there. We don't get vitamin D in the winter, especially in the northern hemisphere. If you live in the south, happy days, but you know, you could probably still supplement with it. And then I take a polyphenol green tea complex just to boost my polyphenols. And there you are. So I'm feeling fine, luckily, touch wood. Obviously this is not wood, this is granite. That's wood. I feel fine, I'm feeling good. Just isolating now. Let me show you what the CDC guidelines are. Just so you are aware. Obviously this is different in the UK, where most of you are probably from. But if you tested positive for COVID-19, go home, self-isolate for 10 days following the onset of your symptoms. If you do not have any symptoms, you should isolate for 10 days following your positive test result. So obviously I'm at home and I'm isolating myself by not being in public. Obviously I went for a walk, but there was no one there. You should not go outside your home except for recommended testing per CDC guidance or require medical care. Do not go to work, school, or public areas and avoid using public transportation, ride sharing, or taxis. Cover your mouth and nose with a face mask. So the CDC guidelines are kind of confusing because obviously it says there that I couldn't go out, but if you go on the website, they also say that you can go for walks, short walks in places where there's no one. And that's what I did. There was no one there. So if you are unsure, if you're high risk, if you are showing any signs of any of the symptoms that COVID people have had, like literally I only had a headache on Thursday, the day before I tested positive. Go and get a test or just quarantine. Obviously if your symptoms worsen, then you know that it potentially is COVID. Just figured I'd update everyone. I'm feeling good, I'm feeling fine. Don't stress. Luckily, it's me, like I've said, in a selfish way and not someone else who could potentially have a worse off situation than I do. I can still train. I'm grateful for that. I can go on walks. I get my steps in. I can get my nutrition in. I had food delivered yesterday, which was great. It was nice not to go to the shops. And that's about it. Any questions? Drop them below. If you have any more concerns or any questions, I'm not an expert, but I do recommend those supplementations. And stay hydrated, that's a big one. Big one. I have a pack of Powerade Zero for the electrolytes. And I also use potassium and sodium in my drinks anyway, just to get that balance and stay hydrated. That's probably one of the bigger ones actually, is hydration. Hydration and eating right and staying on top of your health. But there you are, I'm done rambling now. Thank you very much. Stay safe out there, people. Still take precautions. And you should be good to go. Merry Christmas and all that jazz.